Good morning, ma'am.
Who are you?
I am the reincarnation of Dr. William Dement, and I am here to help you with your sleeping problem.
Who said I had a sleeping problem? I just slept for like 6 hours, I think.
The average person needs to sleep between 7 to 9 hours a day, so 6 hours is not great. So, how many hours of sleep do you normally get?
I normally sleep 6 hours, and I wake up kind of sleepy most mornings, but I'm usually okay with some coffee. I haven't really been sleeping well this last week, though. School's just been really stressful.
Well, hours of sleep is just the beginning. I think we should assess the quality of your sleep. So, how long does it usually take you to fall asleep?
I'm not sure exactly, but usually it takes me a while. I have anxiety, and my mind always feels like it's racing, so when I try to fall asleep, it doesn't always work. Sometimes I take melatonin or Benadryl to help me fall asleep, and this usually helps.
And how long has this inability to sleep been occurring?
It's been occurring pretty regularly since I started college. I would say most nights are a struggle to fall asleep and stay asleep, but I usually catch up over the weekends.
I see. Have you heard of sleep debt before?
No, not really.
Sleep debt is a cumulative effect of not getting enough sleep over time. This means that the more days you go without adequate sleep, the more hours of sleep debt you are accumulating. The deficit you accumulate over a week of poor sleep would not be well addressed by a few days on the weekend that you fall asleep earlier. Sleep debt also affects your productivity, so an acquired sleep debt can make you feel less focused and less productive throughout the day.
Makes sense. Sometimes it's hard to keep a consistent wake time and sleep time.
Consistency is certainly key in sleep hygiene and ensuring a non-disrupted circadian rhythm.
Circadian rhythm?
Nearly every organism, like me, has a circadian rhythm. This refers to our internal clocks which anticipate environmental changes and allow synchrony of our internal processes and external events. It involves two parts, the reactive homeostatic sleep drive having to do with how long you're awake and tiredness, and your circadian clock that is cyclic and predicts sleep. It also is really impacted by light, so you should definitely make sure to get enough light during the day and avoid light at night. Consistency around when you go to bed and wake is also really important.
That makes sense.
Also, how often would you say you wake up during the night and you can't fall back asleep?
A few times, I think. Sometimes I wake in the middle of the night feeling like I was forgetting to breathe. My roommate wakes me up on occasion because I'm snoring too loud, and sometimes it's hard to fall asleep afterwards.
Sleep should be silent, did you know that? Also, it is normal to wake up many times during a night of sleep without realizing, but what's abnormal is actually not being able to fall back asleep after. Also, do you know if you're breathing through your mouth or your nose when you sleep?
I've been a mouth breather since I was a kid. I can't help it.
I wonder, do your parents have sleep apnea by any chance?
Yeah, I think they were diagnosed a while ago. I never really understood what it meant beyond that they just snore really loud.
Well, from what you told me, it sounds like you might have chronic insomnia and sleep apnea.
That sounds scary. What does that suggest exactly?
Well, insomnia is characterized by trouble falling asleep or staying asleep, and chronic insomnia disorder is when these symptoms occur at least 3 times per week and are present for at least 3 months. This inability to sleep often leads to daytime impairments, but don't worry, about 12 to 15% of adults have chronic insomnia, so you're actually not alone.
And what about the sleep apnea?
Sleep apnea occurs when a person has difficulty breathing or has a pause in their breathing due to a blockage in their throat. This occurs when the brain prioritizes sleep over breathing. It's estimated about 26% of adults ages 30 to 70 have sleep apnea, and this can lead to some serious complications. Without treatment, there's actually an increased risk of car accidents, strokes, arrhythmias, heart attacks, and death.
So what should I do about all this?
First of all, I'd recommend going to get a sleep study done to see if you have sleep apnea. If this is the case, your symptoms can be vastly improved by using a continuous positive airway pressure machine, also called a CPAP machine. Secondly, there's some behavioral changes you can make to improve your insomnia symptoms, including cognitive behavioral therapy. Other things I'd suggest for insomnia are avoiding napping too much during the day, avoid stimulants like your coffee too close to bedtime, establish a regular relaxing bedtime routine, and associate your bed only with sleep. So no more studying in bed or late night lattes.
Okay, I can try that. Should I keep taking the melatonin and Benadryl to help me sleep?
I wouldn't recommend the Benadryl. It's not really meant to be used that way and could have some negative side effects. As for melatonin, this can be helpful for adjusting circadian rhythm, like in jet lag, but it's really only been shown to help people fall asleep about 7 minutes faster. Also, since it's not prescribed as a controlled substance, a lot of over-the-counter melatonin actually contains other things that it shouldn't, like serotonin.
Okay, noted. I'll try to keep those sleep hygiene techniques in mind and maybe look into CBT before turning to medication next time. Also, weird question, but what are you doing in my dream? Where am I?
Ah, so you've realized that you are dreaming now. So it seems that you have started lucid dreaming as you are aware that you are in a dream. You, my friend, have already gone through sleep phase 1, which is when you might think you're awake, but you're actually slightly nodding off. You might not remember this, but this occurred right when you sat down in your car and you started to feel drowsy and unalert. You have also gone through non-REM phases 2 and 3. I am here because you are currently in REM sleep, or rapid eye movement sleep, which is the most important for rest and well-being and is where most dreams occur. In fact, 20% of our sleep as adults is REM sleep. However, it sounds like you're waking up now, perhaps.
Don't go! Wait, don't go!
Let me leave you with these last words of wisdom. Sleep is essential for growth, nervous system function, survival, and well-being. The need for sleep is biological, but the way you sleep is learned. And drowsiness is...
Red alert!